Hi, I'm Austin Bracey, and this is my contemporary issue presentation for ECH 4934. Before I start, I want to apologize to my group and say thank you for supporting me. I was in the ER a couple days ago, so I missed out on their presentations, which is why I am doing mine here. My presentation will focus on drug delivery methods. Just a bit of background information. There are two major classes of drugs. Those are small molecule and biologic. For small molecule drugs, they are usually synthesized in a lab using rational drug design methods, which involve using a computer to predict what protein a small molecule is most likely to bind. And by using target sites for proteins involved in important processes, they can develop drugs that will inhibit a process. And sometimes these are found in nature. For example, antibiotics are found naturally by looking at organisms that can resist bacteria and by isolating the compounds they use to do that. Whereas biological drugs are found in nature and they are protein-based. The prominent example is antibody therapy, which is used as an immunological therapy against cancer. A bit of information about bioavailability. This is a pharmacological technique used to determine the amount of the drug that will actually enter the bloodstream. For IV injections, naturally you have an extraordinarily high bioavailability. This reaches 100% theoretically because it's being directly injected. Whereas oral protein therapies have extremely low bioavailability, and this is due to incomplete absorption and something called first-pass metabolism. And both of these concepts are related to the acidic conditions of the gut and the fact that proteins will break down, dissolve, and denature in that kind of environment. So here are some drug delivery methods that are currently used. We have oral therapies, IV, injections into the muscle, transdermal patches, and vaporizers. When considering biological methods, the IV is not realistic. It involves somebody going to the hospital every single day, and that's just not something that you can expect a patient to do. Transdermal patches do not work because of the hydrophobic nature of proteins. They simply will not penetrate the skin. And then you have vaporizers, which would require an environment that is so hot that it would oftentimes have degrading effects on the protein. And so that only leaves oral therapies and injections. The problem with oral is that it has a low bioavailability, like I mentioned before. And with injections, it requires frequent injections due to the fact that protein metabolizes very quickly. For oral drug delivery, the problem, like I said, is low bioavailability, and the solution is that they're developing drug delivery vehicles. Some examples that I found are capsids, bacterial cells, and lipid-based. The lipid-based is also fat-based, but there's a problem with this in that everybody's gut is different and has different conditions and different lengths of the gut for different sized people, and you have a very limited time in which the vehicle can dissolve and release the protein. If it's done too early, it's still an acidic environment that will degrade your protein, and if it's done too late, it'll leave the body before it even releases. Whereas when you have injections, protein is metabolized very quickly, like I said before, but also the simple problem that people are afraid of needles. In order to get around this, they've developed something called the auto-injector, which you hold up to your skin and it will automatically send a needle from the inside of the device through your skin and then inject your drug. And then the other is a simple pump, which is implanted into the patient. Unfortunately, this requires surgery and upkeep, so it has its own downsides as well. Some things to consider for injections are the viscosity, the volume of the fluid, and the speed of delivery. And these all have curves of how much bioavailability you can expect for different conditions. You also have to consider the ease of delivery. If you have a plunger that needs to be pushed down in order to activate an auto-injector, you're going to have elderly patients who might have trouble with that. Or, for example, if the drug is for arthritis, you can expect similar problems. If you have even a simple button that needs to be pushed, if it's held in an awkward position on the thigh, for example, you're going to have the same problems. with some people. So just to review, biologic drugs are sensitive to conditions in the gut. To get around this, scientists have developed oral vehicles and injections for delivery. And it is the job of chemical and pharmaceutical engineers to be involved in both the development and the manufacture of these delivery systems. And the development purpose is to ensure that it can be manufactured on a large-scale environment.